you should probably stick with investigating about it. Get into some community stuff. Already have beforehand.
This wasn't a house of cards, man.
Oh, now it is. Good evening, ladies and gentlemen. Welcome to the Ottawa Board of Health public meeting. My name is Rick O'Connor. I am the City Clerk and Solicitor for the City of Ottawa, and I will be the presiding officer for the first few minutes of tonight's meeting. I would like to begin by welcoming all the board members and asking that in accordance with the procedural bylaw, I am going to do the declaration of public office. So I'd ask all board members to repeat after me. And you will, of course, begin with your name and then say it and then repeat after me. So I, having been appointed as a member of the Board of Health for the City of Ottawa Health Unit, I do solemnly promise and declare number one, que je me quitterai fidèlement et impartialement de mes fonctions au mieux de mes connaissances et de mes compétences. Two, that I have not received and will not receive any payment, reward, or promise thereof for the exercise of this appointment in a biased, corrupt, or in any other improper manner. Trois, que je déclarerai tout intérêt pécuniaire direct ou indirect conformément à la loi sur les conflits d'intérêts municipaux. And I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath.
And I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath.
Thank you all and welcome to the first official board meeting with all of the new board members. I'll now draw your attention to the podium, please. I would now like to introduce and invite Councillor Mark Taylor, who is Deputy Mayor for the City of Ottawa, to come forward for the presentation of his oath of public office. Councillor Taylor, congratulations.
Thank you very much, Mr. Clerk.
Here you go.
Thank you.
Do we have a
very much.
photograph?
Yes.
We have to move. Oh.
Thank you very much, Rick, and good afternoon, ladies and gentlemen. I want to certainly recognize my council colleagues who are here in attendance, as well as the Board of Health members. Rick O'Connor, our City Clerk and Solicitor, Dr. Israel Levy, our Chief Medical Officer of Health. On behalf of Mayor Watson and my council colleagues, I'd like to thank you for inviting me here to welcome our new Board of Health. I would have had to have been here anyway as a member of our Board of Health, but before I welcome the new members, I would like to pay tribute to the outgoing board. Through the hard work and strong effort, the former board, with Chair Diane Holmes and Medical Officer of Health Dr. Israel Levy, helped bring financial stability and predictability to the operations of the Ottawa Public Health Unit. Tonight's meeting is a special one for a number of reasons. Next month will mark 4 years since the establishment of a semi-autonomous Board of Health in Ottawa. Over the past 4 years, we've seen strides in public health thanks to the leadership, commitment, and dedication of Ottawa Board of Health working with Ottawa Public Health. This has included spearheading the Healthy Eating Active Living strategy, which has led to improved physical activity and nutrition guidelines in daycares. We've also seen increased inspections of personal service settings, access to mental health services, and sexual health clinics across the city. as well as enhanced management of outbreaks in the city's long-term care facilities and retirement homes. Not to mention the Let's Clear the Air strategy, which modernized our smoke-free bylaws and focused increased efforts on cessation supports. Now, Ottawa has among the lowest smoking rates in Canada. These multi-year strategies are just a few of the essential public health services that touch the lives of Ottawa residents each and every day. And today we build on these touchstones by welcoming a new Board of Health. Each member brings unique strengths, experiences, and perspectives to this table. And together the Board is united in its commitment to engage, collaborate, and champion public health for Ottawa today and over the long term. I wish you all good luck and good governance for the duration of your term. I want to thank you in advance for your hard work for the residents of Ottawa. And now, without further ado, I'm pleased to present each board member with their certificate of oath of office. And I'll call each member up alphabetically to join me at the front, starting with Councillor David Chernyshenko. And now, Minister Nakfi just joined us, so if you're amenable, David, I'd like to have the Minister come up and join us on behalf of the Province of Ontario, the other partner and driving force behind our public health unit, for the presentations. Councillor Matthew Fleury. Member Dr. Atul Kapoor. Dr. Louis Lakin. Councillor Catherine McKenney. Member Suzanne Pinnell. Councillor Shad Qadri. Oh, did I get the wrong one? Nope. I don't know my alphabet. Member Joanne Poirier. Councillor Michael Kakish. And Member Peter Tilley. Okay, so because Ottawa Public Health is all about active living and we made you all sit down, we're going to make you all come back up again for a group photograph with the minister before we begin the meeting, please.
Oh, the canal? Oh, yeah. The skating was amazing on the weekend. Capacité officielle.
C'est ça, parce qu'on t'a vu à la télé cette fin de semaine.
Pardon?
On t'a vu à la télé cette
Ah,
fin de
ouais.
semaine. Pauvre toi.
Literally, too.
Voilà.
I'm impressed.
Ladies and gentlemen, Minister Nakfi.
Thank you. Thank you, Mark, and very excited to be here at the inaugural meeting of the new Board of Public Health. I want to congratulate all elected and non-elected members to the board. Thank you very much for taking on a very important responsibility in making sure that we are all working together, rowing in the same direction when it comes to building a healthy city. Those of you in the audience who may be wondering why I'm here and perhaps my connection to this board and boards before has been that I had the great opportunity working with our city councilors in bringing a private member's bill to make our Board of Public Health an independent board from the city council. As many of you may recall, in the past, our city councilors were sort of the decision makers, just like the folks are sitting here, which for some of us felt a little odd, because when it comes to public health decisions, we need to make sure that we've got an autonomous or independent board, just like we have, for example, Ottawa Police Services Board or a board for Ottawa Community Housing. And it was through the support of many of the council members that I was able to table the private members bill, which was then adopted by the government and was brought into law in 2009. And we've been very fortunate in Ottawa to have an independent board of public health since that time. They always tell you not to single a person out when you're making comments, but I will go on a limb and I'm going to single out my very good friend and mentor, Marguerite Keeley, who was a member of this board since 2009 up to now. Marguerite was the executive director of the Centertown Community Health Center when I had the opportunity to be a member of the board. So a lot of my learning when it comes to public health issues, when it comes to issues around social detriments to health, is as a result of what Marguerite hammered in my head since then. So Marguerite, thank you very much for your service to this board and everything you've done to build a healthy city of Ottawa. We very much appreciate your public service. Thank you. And I look forward to working with all the new board members in making sure that when it comes to proper assistance from the province and making sure that when it comes to making sure that province and our city are putting the right policies in place to build a healthy city. For example, the most recent legislation that is being debated in the House right now in terms of making healthy choices, where we're going to require large restaurants to have calorie counter, something that our board has spoken about in the past to fight obesity in our population. Those are the kind of initiatives I'm confident we'll continue to work together in bringing into laws so that Ontario is one of the healthiest provinces in Canada, in fact, in North America. So congratulations, and look forward to working with all of you. Thank you very much.
Roll call, Madam Secretary, please.
Councillor Shanashenko.
Présent.
Councillor Fleury.
Ici.
Member Kapura.
Here.
Member Lycan.
Here.
Councillor McKenney.
Present.
Member Pinel.
Présent.
Member Poirier.
Présente.
Councillor Kadri.
Present.
Councillor Kakish.
Present.
Councillor Taylor.
Here.
Member Artili.
Present.
We have a quorum and we have no regrets, so thank you. Declarations of interest. Are there any declarations of interest before we begin the meeting? Member Lycan,
Yes.
can you go ahead and read your declaration, please?
Submit a declaration of interest on item 4, the draft Board of Health operating budget. Currently, my son is the supervisor of Ottawa Public Health's mental health and youth section. The budget before the board includes a $300,000 100% funding which supports Ottawa Public Health's mental health and youth programming.
Thank you, Member Lakin. That'll be dealt with during the budget discussions. Any other declarations of interest? Seeing none, confirmation of the minutes of the meeting of January 19th, 2015. Carried. Communications, there are 4 items listed and they are on hold with the Secretary. Member Fleury, motion to introduce reports.
Merci, Monsieur le Président. To be resolved that the election of Chair and Vice Chair report, the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, the Draft Board of Health 2015 Operating Budget Report, amendments to Ottawa Board of Health Policies and Bylaws, 2014 Operating Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, and delegation of authority contracts awarded for the period of October 1st, 2014 to December 31st, 2014 be received and considered.
Carried. Thank you. In accordance with subsection 57, sub 2 of the Health Protection and Promotion Act, I will request nominations for the position of chair. This will be a chair who will serve for the remainder of the 2014-2018 term of office, to be confirmed at the first meeting of every year as per the legislation. In the event that more than one member has been nominated, a runoff vote will be called. At this time, I request nominations for the position of chair for the Board of Health for the City of Ottawa Health Unit for the remainder of the 2014-2018 term, and I will accept nominations now. Member Chernyshenko.
Thank you. I would like to move that Councillor Shad Kadri be nominated for the position of chair for the Ottawa Board of Health for the remainder of the 2014 to 2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Member Kadri, do you accept the nomination?
I do.
Thank you. I'll now call a second time for any additional nominations for the position of chair. Seeing none, I will now call a third and final time for any nominations for the position of chair. Seeing none, Member Chernyshenko, would you please read the motion to close the nominations and the motion for the chair to be appointed?
That nominations for the position of chair be closed.
All in favor? Carried.
One more.
Member, if you could read one more motion.
That the Ottawa Board of Health appoint Councillor Shad Kadri as chair for the Ottawa Board of Health for the remainder of the 2014-2018 term, and that the chair be confirmed at the first meeting of each year of its term as required by the Health Protection and Promotion Act.
Congratulations, Chair. Please come and resume your seat.
Thank you very much, everyone. Good evening. Now, it's my pleasure to have a nomination for the Vice Chair of the Board. And could I get that nomination, Chair Taylor?
Absolutely, Mr. Chair. I would like to move that Member Poirier be nominated for the position of Vice Chair of the Ottawa Board of Health for the remainder of the 2014 to 2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Thank you. Are there any other nominations for the Vice Chair? Seeing none, I'll repeat again. Are there any other nominations for the Vice Chair? And for the third time, any other nominations for the Vice Chair? Seeing none, Mr. Taylor, Councillor Taylor, could you go ahead and read the rest of the motion?
I would. I'd like to move that nominations for the position of Vice Chair be closed.
Thank you.
And now I'd like to move that the Ottawa Board of Health appoint Member Poirier as Vice Chair of the Board of Health for the City of Ottawa Health Unit for the remainder of the 2014 to 2018 term, to be confirmed at the first meeting of each year as required by the Health Protection and Promotion Act.
Thank you very much, Councillor Taylor, and Madam Poirier. Welcome and congratulations.
Thank you very much.
If I can just get 2 seconds to get reorganized here. And while I'm doing that, I just want to thank everybody in the audience for coming to attend this first board meeting of this new Board of Health for the next 4 years. And just to mention on that account, both Dr. Levy's and any other board member in this board, including myself as the chair, my door is always open for anybody who wants to speak and talk to myself, as well as the good doctor and any other board members. So keep that in mind going forward. And it is now my pleasure to say a few words on my verbal report. Good evening and welcome to the first official Board of Health meeting. Bonsoir, mesdames et messieurs. Bienvenue à la première réunion du conseil de santé de Ottawa. Je suis heureuse d'être la présidente de la commission de la santé. I'm honored and privileged for the opportunity to work with you as the new chair of the Ottawa Board of Health for the next 4 years. Oops. Pages, I guess, are stuck together. I wish to thank the former chair, Diane Holmes, and the inaugural board members for their years of leadership and guidance during the first term of the board. The Ottawa Board of Health is made up of individuals who have varying backgrounds of experience and knowledge. But we all come to the table with a common goal: to ensure a voice for the public and to continue to enhance the health and welfare of the community in working with the Ottawa Public Health. I wish to take this opportunity to highlight our public board members and their achievements, starting with Peter Tilley. Mr. Tilley has served as the Executive Director of the Ottawa Food Bank for 14 years, until taking on his role as an Executive Director in 2013 of the Ottawa Mission. Peter teaches a course during the weekends at Algonquin College, the Introduction to Nonprofit Management. It is my pleasure to welcome Peter to the Board of Health. Next, Dr. Kapoor Atul Kumar is a physician in the Department of Emergency Medicine at the Ottawa Hospital. Dr. Kapoor was vice chair to the board from 2010 to 2014. He currently sits on a number of health-related committees, such as the Board of Directors for the Ontario Medical Association and the Canadian Medical Association. Dr. Kapoor has participated in a number of selected health publications. I'm pleased to welcome Dr. Kapoor back to the table. Dr. Louis Lakin, Doctor of Psychology, Clinical Professor of Psychology at the University of Ottawa, and Staff Psychologist at Children's Hospital of Eastern Ontario. Dr. Lakin currently sits on the Jewish Federation of Ottawa Independent Task Force and has participated in a number of medical publications. After reviewing Dr. Lakin's astute bio, I have to say my favorite part was the conclusion, where he recognizes really important stuff: his 2 children, 3 grandchildren, and an embracing number of bikes, skis, and hockey sticks. Welcome, Dr. Lakin. Joanne Poirier is no stranger to City Hall. In 1993, Joanne was the Commissioner of Client Services Department until 96, when she became the Deputy City Manager. Joanne has received a number of acclamations and awards for her commitment and contributions. In 2012, she received the Queen Elizabeth Diamond Jubilee Medal and over 50 housing awards. Joanne spent 5 very successful years as the Chief Executive Officer of Ottawa Community Housing, and the second largest housing provider in Ontario. In 2014, the Victorian Order of Nurses Canada caught Joanne's eye, where she is now the President and Chief Executive Officer. I've had the privilege of working with Joanne on the Board of Crime Prevention Ottawa for 3 years. It is my sincere pleasure to welcome Joanne to the Board of Health. Madame Pinnell, Suzanne Pinnell, holds a degree in nursing sciences from Ottawa University and a diploma in public health. For the past 6 years, Suzanne has been an appointed member of the board of La Cité Collégiale, serving as chair of the Governance and Nomination Committee. She worked as a clinical instructor in pediatrics and psychology of growth and development at the Ottawa General Hospital, Ottawa University's School of Nursing, and was part-time teacher at Algonquin College in the conseil de défense mentale. Suzanne has sat on several boards, including the CHIO Foundation and the Board of Canadian Institute of Child Health. Bienvenue, Madame Pinnell. C'est un plaisir de vous avoir ici. Now, I was going to introduce all my council colleagues, but I think you know all of them, so I'll forego that. La communication est importante. s'il vous plaît, c'est que je veux continuer à travailler pour améliorer ma capacité de parler en français. There's an important work to be done over the coming months and years. OPH is steadfast in its commitment to deliver high-quality programs and services. Regarde Santé publique Ottawa impatient de travailler ensemble avec les partenaires communautaires dans le but d'optimiser nos efforts continuous sur le long terme. Ottawa Public Health looks forward to working together with community partners with the goal of optimizing our continued efforts over the long term. OPH will focus on sustaining services and addressing emerging community needs and public health risk. The Ottawa Board of Health plays a key role in working with Ottawa Public Health to identify the needs and well-being of the city as a whole. Together, we will continue to work to identify and address the health needs of the community through a range of programs and service. Public health plays an important role in the community on so many different levels, through promoting a healthier population, responding to threats of public, and by extension, reducing demands on the health care system. It is my responsibility as an elected official and Chair of Board of Health to demonstrate a commitment to a healthy community by providing leadership and decision-making that considers health and well-being in policy decision and planning, as well as in type of partnership that are developed and maintained. I look forward to working with Ottawa Public Health, community partners, my fellow board members, with the goal of optimizing health of our community over the long term. Also, I wanted to note that the Honourable Mr. Yasser Naqvi has sent letters of congratulations to all board members. As many of you will recall, Minister Naqvi was instrumental in the tabling and passage of Bill 16, which established a new governance model for the board and made amendments to the City of Ottawa Act. On behalf of the board, I would like to thank Minister Naqvi for sending these letters, which I will be sharing with the board members. A major duty of this board will be setting the strategic priorities for Ottawa Public Health for the next years. This coming Friday, the board will begin discussions about the strategic directions which will guide the Board of Health for the next 4 years. Over the past year, OPH has collected input from staff, the public, community partners, as well as considered health data and key sources of literature to guide the development of strategic priorities areas. I look forward to this discussion and anticipate that the board's strategic planning will be presented at the next Board of Health meeting in April. Maintenant, c'est mon plaisir de vous présenter le Dr. Levy, médecin en chef de la santé. Now it's my pleasure to pass the floor to Dr. Levy, the Medical Officer of Health, to present his verbal report.
Merci beaucoup. Many thanks and congratulations to you, Mr. Chair. Good evening, everyone. Bonsoir. And welcome also to all our new public members. I look forward to working with you all very much in the coming term. I want to thank you particularly for your interest in this board and congratulate you on your appointment. And I too want to welcome Minister Naqvi and thank you for the support that you've given us from inception, really, in spirit. And indeed, Member Keeley, who still feels like a member, who promised that I wouldn't be getting rid of her, and here you are. So thank you. It's good to see you. I also will mention that those of you who don't know me, there's something quite remarkable happening right here. My wonderful colleagues on staff at Ottawa Public Health, who I've often talked about, have achieved yet another miracle in that I am online. I do have my paper backup just in case, but by next meeting I too will be entirely paperless, hopefully. So I will just make a few comments about what's been going on in our world in terms of a verbal update. Of course, at the last meeting of the Board of Health in January, we tabled the draft operating budget for 2015, which you'll be considering tonight for approval. Since that time, we've received community responses to the draft, a summary of which was very recently shared with you. There have been one or two comments that came in since then, which were also shared with you by Ms. Connolly. Of course, the way we're delivering our programming is changing. The draft budget that's before you allows for reorienting of our family and child health programming, particularly with the intent of increasing focus on clients with identified risk factors and to respond to calls from new parents. I do want to reiterate again, I know that the concern has been out there, but OPH will continue providing support to all families. This is not a move that we will contemplate as health professionals that would involve increasing risk or decreasing availability to families that need support. It's our aim, of course, then, that any new parent who requests a home visit from a public health nurse will get one. And as always, residents can connect with the nurse over the phone line and by calling our information and coordination line. I think we talked about it at the last meeting, but the essence of what we're doing in many respects is looking for new ways to work within existing funding, including by bringing new resources online. The budgetary pressures that I have mentioned, I predict, are not going to ease in the foreseeable future when you look at the positions of our funding sources. So the online way of reaching the community offers both opportunity but also is a necessity. We very recently launched our Parenting in Ottawa Facebook page just about 2-3 months ago, and the response has been rapid and reassuring. I was a skeptic when it was first brought to my attention, but I have to say that I think that the team was really onto something. We've had literally thousands of Ottawa residents visit our pages. They're bilingual, of course, as all of our pages are. We've had over 7,700 Facebook likes, and even I know that a like actually is significant. We are noted, and we are a source of information. Nurses, of course, are online also to answer questions that come from one of the thousands of parents who've connected with us through this mechanism. Switching gears, many of you, of course, will also have heard recent media reports about our immunization program. And I want to really convey to all the residents of Ottawa through you that Ottawa is a community that is well protected against vaccine-preventable diseases. We have generally good rates of immunization coverage, and we have low rates of vaccine-preventable diseases such as measles. This, in very large part, is due to the fact that people take responsibility for their health, heed the advice, and are in fact getting themselves and their children vaccinated. We're very appreciative of that partnership with our community, and we're working hard to keep it that way. In recent weeks, though, members of the media have questioned whether Ottawa Public Health is in contravention of any of the laws with respect to immunization. And at this time, the ministry has requested that all medical officers of health in the province, the 36 of us, complete a checklist that indicates whether their boards of health are meeting currently the Ontario Public Health Standards and Protocols in respect of vaccine-preventable diseases programming. The ministry goes on to ask that if the standards or protocols are not being fully met, that there's a requirement that a compliance report template be completed. The city clerk and solicitor has provided his opinion, and it's certainly mine too, that we are in full compliance with statutory and regulatory obligations. I can confirm that we're preparing plans to address any variances from the standards or protocols with which we must comply under the Public Health Funding and Accountability Agreement, and will provide the board with updates in that regard in the weeks and months to come. Of course, we routinely provide you with updates regarding the Public Health Funding and Accountability Agreements, but to the degree that we may need to complete a specific template with respect to this particular inquiry from the Ministry, we'll obviously apprise you. In addition, I can confirm that, of course, we're fully committed to full compliance across all standards and protocols, and will provide the board with additional information in the weeks and months to come. Staying on the subject of vaccine-preventable and infectious diseases, those of you who are here will recall that in my last update, I mentioned that we've had an extremely busy respiratory virus season in this community. We continue to work with long-term care facilities, with retirement homes in the community to reduce the spread of these viruses and the impact in the community. But it really has been one of the most severe influenza seasons we've seen in many decades. We now have 21 deaths that are laboratory confirmed as associated with influenza in Ottawa. Of course, we don't really focus a lot of attention on flu death numbers. Laboratory confirmed numbers are an indicator of activity like many other indicators. For example, there have been more than 1,600 residents or staff in long-term care and retirement homes that have been ill with influenza, and about 150 have been hospitalized. These are numbers that, when you compare to other years, are quite high. In and of themselves, they don't carry that much specific weight, because we know that that influenza is not often tested for. So these are minimum numbers, but they give us a sense of how active the virus was in the community. And that certainly, as I say, has been a challenge, and it's stretched some of the staff in those programs. Fortunately, of course, we're coming to the end of the traditional flu season, and while we continue to see outbreaks, we're now down to smaller numbers than we were at the peak a few months ago. So hopefully we're coming out of this now. On a note that I've mentioned previously as well, that seems to have fallen away from the public consciousness, but I think is important that I reassure you that we're working closely with provincial and federal public health professionals continuously on the Ebola file. We are still monitoring travelers returning from West Africa in order to ensure that any signal that they may become ill is quickly heeded. This is one of many ongoing types of work, of course. We continue our routine surveillance of restaurants, our restaurant inspections, fall prevention programming for seniors, clinical services at our sexual health and dental clinics, just some of the examples of the programs and services that many of you heard about during the orientation session last week. So I'll wrap up there, except to commit again and to reassure you that despite the funding challenges and the need to reorient programming, I really am confident that our ability to continue delivering quality programs and services that the residents of Ottawa deservedly expect of us is there. We have a very dedicated workforce, as you know. We've spent a lot of time thinking about how to manage the future. We have good partners in the community, and while the times ahead I think will be challenging, I am committed that this community will continue to receive the services and the prevention of health risk that, as I say, is expected of us. That concludes my verbal report. As always, I'm happy to answer any questions. Merci beaucoup.
Councillor Fleury.
Thanks for the report. I, as a board member and member of the previous board, I want to be assured that we've met all our responsibilities regarding the provincial requirements for the vaccination program. So for me, in terms of board liability, in terms of our responsibility to our community, it's important that we understand, that we know that we're fulfilling the objectives of those responsibilities.
Through you, Mr. Chair. Thank you, Member Councillor. I can assure you I've been in contact with the City Solicitor. My comments, as just made, reflect our confidence that we're meeting the statutory and regulatory obligations we have. To the degree that there may be variants, we're exploring those now. We're literally in the midst of looking through the programming in response to the ministry inquiries of all health units. and we'll be bringing back, well, we'll be submitting a report to the ministry, of course, which you'll be apprised of. Not sure if Mr. O'Connor would like to add to that.
Well, Mr. Chair, just if I may, the Ottawa Public Health Unit, in my opinion, is in fact in compliance with a variety of your legislative responsibilities, including the Health Protection Promotion Act, the Day Nurseries Act, and the Immunization of School Pupils Act, and all of the regulations that fall thereunder. Now, I don't want to sound overly legalistic or too semantic over this sort of thing. The Medical Officer of Health has indicated that there has been a request from the ministry for all of the health units in the province, including this one, and we will be complying with providing any variance information that we have with regards to those. Those are under the standards and protocols that I know most of the doctors on the board are certainly aware, and most of the staff are. Those are not, law per se, but they are something that's very important, and the doctor is working with his colleagues at the ministry to make those determinations, and the board will be apprised in due course.
And just a similar question, but a different topic. So I followed the local issue regarding vaccination and, some of the challenges we had with the daycare. And I wonder, in my mind, what is our authority as Ottawa Public Health or as a city regarding a refusal of a parent to vaccinate their child for our schools?
Through you, Mr. Chair, parents are obligated, children need to be vaccinated prior to school entry in the province of Ontario, and are required to report to public health units the fact of that vaccination. So Ontario has the advantage of having legislation that facilitates very high coverage rates. There is an exemption allowed within the Act for parents to declare or request an exemption for different reasons, and we facilitate that. We don't encourage it. We try and work with parents, provide information, provide supports that would have a parent make a different decision. But under the legislation, that exemption opportunity does exist. It's our experience that less than 2% of Ottawa's parents choose to go the exemption route, which I frankly celebrate and would prefer that to be zero. But that level of exemption rate does allow for what we call herd immunity within the community. So I think we have good legislation in this province. And in this city, we have good uptake of vaccination and we have good protection.
And just to follow up to that, in the public health world, what is the difference in messaging for yearly flu vaccine shots versus what we were just exchanging on the sorry, I don't have the medical term here, but the more scientific polio and other immunization, approaches?
Through you, Mr. Chair, it is our intention to bring forward to this board, whether or not you declare that it's a strategic priority into the future, a report, a comprehensive report in terms of the future of the immunization program. And it's a very fundamental but complex area of public health practice. It represents probably about 8% of our activities, roughly speaking, when you look globally at all the work we do. But it is, along with clean water, those two interventions are probably the most significant interventions of the last 150 years in terms of actually adding to the longevity and well-being of our society. The question, what I'm really getting at then is the question is complex. The simple answer that I would provide at this stage, pending a more detailed and comprehensive report for discussion, is that there are certain vaccine-preventable diseases that are amenable to early childhood vaccination, that allow for long-term, perhaps probably lifetime, in some cases definitely lifetime protection against diseases that once killed and maimed. There are other diseases, other pathogens, viruses, that for various biological reasons require periodic updates. Influenza in particular shifts its biological structure on a roughly at least annual basis every season, and that's why the protection that we get from a single vaccine for a pathogen like influenza is not lifetime protection, whereas smallpox, which is not one of the vaccines we still give because it's the great success story that has been eradicated. Smallpox, we get a excellent lifelong, at the other end of the spectrum, coverage, and individuals are in fact protected and allows humanity to eradicate scourges like that. So when we think of measles, mumps, rubella, diphtheria, polio, tetanus, these are the fundamental vaccines that for a long time have been part of the Ontario legislation. All of them are diseases, germs, that are very amenable to single or vaccines with just a few boosters in early childhood. They're diseases that used to spread in the early years and cause most of their impact in their earlier years. And so those are the diseases that were contemplated in the original Ontario legislation. Just last year, the legislation changed, which has been part of the transition. There was legislative change. There was also change in some of the IT systems. So the vaccine world within Ontario programming has been changing, which is part of the challenge that we've all been dealing with. But that's the essence of it. And what I would take the opportunity just to add to that is there are other vaccines that are very good in other stages of life. Adulthood and seniors benefit from vaccine boosters and benefit from protection against different diseases at different stages of life. So you really have influenza at one end of the spectrum, you have smallpox at the other end of the spectrum, but there's a host of individual vaccines. I think there's 17 now that are publicly funded in Ontario, and each is somewhat different in terms of when it appears on the schedule and what the scientific and clinical recommendations for it are.
Councillor McKenney, member.
Thank you, Chair. I just want to voice, I guess, my concerns with the program Healthy Babies, Healthy Children, and the reductions that we're looking at to that program. You know, I do respect that staff had difficult decisions to make given the 2% target that we were that council gave to staff to come back with a balanced budget at 2%.
Sorry, Councillor McKenney, that is something that we'll discuss at the budget item. We're just right now speaking about Dr. Levy's verbal report.
Okay, so just a quick question, because he did touch on it, or I can wait until we get right into the budget.
If it's just a technical question, you can go ahead. If not, then I would advise that you wait till the budget debate. Okay, there we go. Thank you. Any other questions for the doctor on his verbal report? If not, can we receive that report for information? Thank you. Now we're going to move on to item number 4, which is the draft Board of Health budget. We've got a presentation. It's a short presentation. And I'll welcome Esther Magdam as well as Lou Flaboria to come to the table to show us the presentation. After which, board member, what I'm going to do is if you have any questions, we can hold off to those questions because we do have 6 public delegations. We'll hear from them, and then we'll open the floor to the members' question, if that's okay. welcome, Doctor, and if you could do the presentation, we'd appreciate that. Thank you.
Thank you very much, Mr. Chair. Good evening. Good evening, members of the board. I have a presentation that is a condensed version of the one that was presented at the January 19th meeting when the draft 2015 budget was tabled. So I will be going over, just to review the highlights as well as a few updates. And Lou Flaboria, our account manager from Finance Department, has joined me, as has Dinah Robinson, our business analyst, for questions at the end of the presentation. Next slide. So we are presenting a balanced budget of $56.4 million, including a city contribution of $12.9 million. And that represents an increase of $302,000 for 2015 from the city. It also includes a contribution of $43.5 million from the province and other sources of revenue, representing an overall budget increase of 1.2% over the 2014 budget. The budget aligns with the city's guidelines for the 2015 budget development and is also respectful of the constraints from the provincial funder. And it assuming a 2% increase on cost-shared programs and a 0% increase on 100% programs for 2015. The budget makes recommendations in two important areas. Firstly, to achieve a balanced budget, we are recommending a reduction of 7 FTE planned vacancies. We are also modifying the family health service delivery model of vulnerable families who are identified at risk through the hospital screen or referred by anyone, a friend, a relative, a self-referral, will receive a phone assessment and a home visit. As well, we will be expanding our reach in the community through an expanded Baby Express model, which will be broadening our reach to include prenatal clients and families with children up to 6, focusing on preventive care and early intervention. In addition, we will be expanding our reach and being even more accessible through new interactive electronic media. The second item that I would like to highlight is our plan for investment. As previously mentioned in January, the budget also recommends that the city continue to address an issue related to infection prevention and control practices in personal service settings. Those are businesses that provide body piercing, scarification, and body branding with the aim of this investment to reduce skin and bloodborne illness. And then the final recommendation addresses our local emerging community needs. And those risks would be addressed through one-time cost-shared ministry grants. As you'll remember, based on last year's success, we are at this time recommending that $50,000 be allotted of the city portion for 2015. However, should the ministry be prepared to address and invest a greater portion of the one-time funding opportunity into the Ottawa community, we may be coming back to you in the city for additional funding to offset the cost-shared requirement. With respect to recent developments, the 2015 OPH budget, draft budget was tabled at City Council on February the 4th, and a community consultation process was implemented that included public meetings and additional opportunities through mail, telephone, and social media. In addition, we were the successful recipients of a ministry one-time in-year funding application, and we have just completed our application to the province, the ministry, for the program-based grant. So upon board approval, the next steps in the budget process will be to forward this budget to City Council for approval on March the 11th, and then we will await ministry approval. The ministry has indicated, on their funding portion, the ministry has indicated that they will be notifying public health departments later this year as to what the ministry-approved funding level will be for 2015. And as well, we will continue to seek any other funding opportunities. So I'll stop there for questions.
Thank you very much. Whoops, sorry. Thank you very much for the presentation. And like I said earlier, if board willing, that I'd like to go to the public delegations first, and then we'll come back to your question if that's okay. All right. So the first public delegation that we have is Dick Stewart. He's a resident. Welcome, Mr. Stewart, and you have 5 minutes to address the board. Thank you for coming.
Thank you, Mr. Chair, members of the board. My name is Dick Stewart, and I'm here as a taxpayer and a concerned grandparent. And I'd like to talk about the cuts and changes to the family health program. Those changes have me wondering about certain elements of this budget proposal, and I'd like to share my wonderings with you in my 5 minutes. I note that on on February the 4th, Mayor Watson said that, quote, no significant service cuts, end quote, will be necessary to implement the 2015 draft budget. So I'm wondering, Mr. Chair, if this means that the family health services delivered by the 7 FTEs were never significant, or they've just become insignificant. I recognize that the province has changed its funding model for these services and perhaps others. But I am wondering why the only acceptable political response is to immediately cut the FTEs and not seriously consider these services as legitimate budget pressures that could compete for municipal tax dollars. I'm wondering also, Mr. Chair, if the board members know what type of FTEs are actually being cut. Are they public health nurses? Are they administrative folks, or a combination? The community doesn't know. I'm wondering also, Mr. Chair, if board members really understand what the term, and I quote from the budget book, multi-year phased-in realignment of services with provincial funding, end quote, really means for the future of this program and other services in public health. It sounds like there are many, many more shoes to drop in years to come. This is, Mr. Chair, an opportune moment for the Board of Health and Ottawa Public Health, as it's beginning to shift services away from traditional in-person services to services delivered through telephone, computer, and social media. So I'm also wondering, Mr. Chair, if the staff proposes to do an impact analysis of these changes using the existing program baseline data, effectiveness data, to compare this to the new services that are being delivered in the future. And I'm wondering, Mr. Chair, if this research is to be done, when this report will be coming back to this board. I'm also wondering, I'm almost finished my wonderings, Mr. Chair. I'm also wondering if the board members know what the current breakdown is of low risk, moderate risk, and high risk families now being served by the family health program. And finally, I am also wondering, Mr. Chair, what strategies this new Board of Health is planning to use to rectify the fact that Ottawa Public Health sits 33rd out of 36 public health units in this province in terms of per capita provincial funding for public health services. So I hope, Mr. Chair, that you and other members of the board will be wondering the same things as I am. Thank you.
Thank you very much, Mr. Stewart, and thank you for your presentation. I'm sure throughout this evening, when we have an opportunity to ask the medical officer health for some questions, some of those items will be raised with the medical officer. Thank you. Our next speaker is Ketrin Dole and Gillian Dawson from Ottawa Food Policy Council. Good evening, ladies. Welcome. and you have 5 minutes for your presentation.
Thank you. Thank you for having us this evening. Myself and Jillian are here on behalf of the Ottawa Food Policy Council. So the Ottawa Food Policy Council is comprised of individuals representing all aspects of the food system to enable a broader and more coherent discussion and elaboration of policies related to food. The mission of the Ottawa Food Policy Council is to work toward a food system in Ottawa that emphasizes the social and economic viability and environmental sustainability through the entire food cycle, and in which food is celebrated and, of course, enjoyed. To date, we have worked with Ottawa Public Health in these ways on the Breastfeeding Friendly Business Initiative, the Client Satisfaction and Breastfeeding Services Survey. Ottawa Public Health also sits as an ex officio with Just Food, providing expertise and support to the Ottawa Food Policy Council. Access to healthy food should continue to be a priority for Ottawa Public Health. Your own nutritious food basket data informs us that it costs $869 per month to feed a family of 4 a basic healthy diet. Food often becomes a discretionary expense when families are forced to pay between fixed expenses such as rent, childcare, and transportation. And given this data, it's not surprising that an estimated 10% of Ottawa households are food insecure. Research indicates that people who do not have access to healthy food suffer from poor physical and mental health, and also have increased chronic health conditions. The work of the Ottawa Food Policy Council aligns with your HEAL strategy to promote access to healthy food through collaborative work with the community.
So what we're here today to do is to not ask you for money. We respect the fiscal constraints that are upon you at the moment. What we're asking for is 3 things. First is that you continue to invest in food as a priority issue, meaning that it remains a key investment area. We commend the initiatives such as the Market Mobile and the Good Food Market that have promoted access to healthy and affordable food. We would also encourage you to look at ways as Ottawa Public Health that you can champion and drive strategic conversations through the city and provide and advise around linkages through other city departments. Secondly, we would ask that you look to the Food Policy Council as a thought leader on food issues, and in doing so, that you would engage with us and consult with us as a key stakeholder when developing public policy related to food and making program decisions. We are here to support you and to be a lens on food policy, and this is an important issue in health. In particular, we'd be interested in discussing your new PHFAA indicator around obesity prevention and any other strategic initiatives. Thirdly, we would ask that you look to us as a partner when considering new opportunities. Dr. Levy, you led the conversation off to this tune, and I had a fantastic opportunity to speak with one of the managers at Ottawa Public Health about just this, and that conversation resulted in us agreeing to look into opportunities to collaborate to pursue a grant and contribution through the Public Health Agency of Canada. To me, that's a great example of the potential of collaboration. So I would ask that you look to us as a partner when considering opportunities to advance your plans and priorities. In particular, given the financial constraints upon you, if you're considering grants or different opportunities in program delivery, that you would turn to the Food Policy Council to facilitate those partnerships for you. So what we ask is not for new funding, but that when you're making strategic considerations about the use of your funding and also potential funding mechanisms, that you consider food security and that you consider working with Ottawa Food Policy Council and leveraging them as a key partner in achieving your strategic objectives. Thank you.
Thank you very much both for your presentation. Any members of the committee have questions for the public delegation? Yes, Councillor Kakish.
Thank you for the presentation. You mentioned Just Food. What is your relationship with them? Because one of the things I'm actually looking at doing, and it's a bit of a newer concept for a suburban ward, but is working on getting a community garden in my riding. And I know Just Food has, I think, grants or funding to help set that up. What does, you're more on the policy on the council, at the council for that part, or how do you partner up with groups like Just Food?
Yes, of course, we partner with Just Food and any other community NGOs in achieving food objectives for the city. Just Food will be here presenting today, and I'm sure they would appreciate the opportunity to talk to you about that. As the Food Policy Council, we would work in any ways with any community within the city to help facilitate opportunities like community gardens, and we would also work in a role to champion the need for that, for community gardens and other food issues.
What's your current budget, and where's the vast majority of your funding from?
Thank you for that fabulous question. We have a very slim budget. We actually worked with the city, with Ottawa Public Health in getting a grant which resulted in the Breastfeeding Friendly Business Initiative and a small pocket of money which financed the Ottawa Food Policy Council. The council is volunteer run. Our budget goes to paying for city facilities to run meetings. So we have a very small budget. I would point out that in many other cities, the city finances food policy councils. In this case, we are working independently and being an impartial collaborator so that we have the opportunity to have that distinct, unbiased, nonpartisan food lens. So I'm not in a position to share specific budget details. They are available through the Ottawa Food Policy Council. I'd be happy to send them to you. But the bottom line is that we have a very small budget that originated from a grant and that we have no ways to currently, at the moment, look at increasing our budget, our operating budget as a council.
Okay. Thank you for your presentation. Thanks, Chair.
Anybody else? Thank you very much, Ms. Dahl and Ms. Dawson, for your presentation. Our next speaker is Patricia Belamingi. I hope I pronounced the last name right.
Of the last. Hello, my name is Patricia Balamingi, and I am the board chair of Just Food, Ottawa's citywide nonprofit lead organization on food security, working towards vibrant, just, and sustainable food and farming systems and good food for all here in Ottawa. I am also professor in the Department of Geography and Environmental Studies at Carleton University, where I quite conveniently research localizing food systems and sustainable community. To begin, I would like to commend the Board of Health for ensuring food security has been a top priority. You have demonstrated this commitment by supporting a healthy eating, active living strategy focused on increasing access to healthy food in all neighborhoods and public institutions, producing the Nutritional Food Basket Report annually, supporting the Poverty and Hunger Working Group, achieving accreditation as baby-friendly, participating in the Community Development Framework, which identifies food security as a top priority, and giving in-kind support to the Ottawa Food Policy Council, a key ally for the Board of Health and for Just Food in ensuring healthy food policy. There are many opportunities to keep food a top priority in the important work that you do at Public Health. During last fall's municipal election, Just Food joined others in asking councillors to champion good food for all, which was identified as including sustained resources to support good food initiatives as an integrated part of Ottawa's infrastructure, the use of a good food lens in planning and policies, including neighborhood access to good food to be achieved via development applications, zoning and bylaw amendments, and social services and community planning. And finally, municipal levers being consistently used to support economic development related to food in Ottawa, including modeling best practices such as local and healthy food procurement policies at the City of Ottawa. On a personal note, having had emergency surgery over the Christmas holidays at the Ottawa General Hospital, while I received excellent care, I can attest to the fact that there is much to be done in terms of improving the food offered to our most vulnerable populations in institutional care. Just Food is connected to a diverse community of individuals and partner organizations who fervently wish for good food to remain a key priority throughout the objectives and resources that you have itemized in the Board of Health budget under consideration. As a long-standing partner of Ottawa Public Health, Just Food has offered assistance on obesity campaigns, partnered in initiatives ranging from establishing breastfeeding-friendly areas to ensuring food access to managing community gardening across the city. We also partnered on the Food for All community policy process that led to the establishment of the Ottawa Food Policy Council. We hope this new Board of Health, and congratulations on your new appointments, continues to see Just Food as a strong ally in this coming term in delivering on our multiple shared objectives. In order to maximize impact, I am also here to ask for this board's support to implement a food strategy during the next term of council. The previous council did identify this as an important direction. In order to reach the goal of good food for all in Ottawa, with rural, suburban, and urban needs to address, Just Food will be submitting for your support proposed direction to confirm and implement an effective, coordinated, citywide food strategy supported across departments and across community networks that builds upon the assets and real opportunities within the city government and within the community to date that are ripe and ready. We are working with key staff, councillors, and partner agencies and will be presenting a 2-page proposed directions by end of next week. As you know, food does not fit nicely and neatly into one department. It fits across all. We feel this is a critical time to implement such a coordinated food strategy in Ottawa, and we trust that with your critical understanding and demonstrated commitment to the food access issues in our city and interest in achieving good food for all as cornerstones for health, you will be able to champion this idea along with other departments. Thank you very much for your time and support.
Thank you very much, Ms. Balamangi. I'm sorry I butchered your name in the initial introduction, so my apologies. Any questions from board members? Yes, Councillor McKinney.
Hi. Thank you for that. Of course, I'm quite familiar with Just Food and the Food Policy Council, and I'm fortunate enough to have in Somerset Ward, we have, our good food markets and our community gardens, and of course we were part of the community development framework. So I just wonder, coming forward, and maybe I'm asking you to give me a sneak peek at what you're bringing, and maybe you can or cannot do that, but will you be able to give us, for example, sort of a cost-benefit analysis? If we invest this much, this is where we'll be able to take our food strategy. If we, I would like to see a food strategy be part of our strategic initiatives. I think it needs to be a priority of this council. We heard from the Policy Council that, to feed a family of 4 is to over $800 a month. So I know that there are many, many families in our community that don't have access to that budget amount for their family. So will you be able to? Is that part of what you'll be able to give us, so that we can make that decision going forward with our term of council priorities?
I'll let my executive director, Mo Garahan, take a first crack at that.
Thank you, Councillor McKinney. I think itemizing the cost of food per family for a basic nutrition basket and connecting that to some of the health costs is an important but difficult correlation to make, because there's so many other factors that are brought into that picture. So we will certainly identify in our directions proposal the cost that we are proposing be invested, which is very very minimal compared to the outcomes that we feel we'll be able to generate. Part of the cost-benefit analysis will be to demonstrate things like the importance of having some key underlying infrastructure to support the wealth of food-based initiatives at a neighborhood level or at the food access level, whether that be food banks and food cupboards, that actually that require coordinated purchasing at good pricing. And that's something that the City of Ottawa does not have right now in the same way that some other cities do. So that type of cost-benefit analysis is something that we'll be able to share.
Thank you, and I look very much forward to it and to supporting that.
Thank you.
Councillor Kakish.
Thank you for your presentation, and again, I know I've been working with Jordan with your staff to try to get this up and running, and I do think a lot of this is grassroots in terms of getting these community gardens, as an example, up and running, and I think we're fortunate to have people here like Peter Tilley who have experience running the food bank and on-the-ground experience to contribute to that, and certainly I think if there is anything we can do to improve our partnerships or our collaboration, then I think we should be doing that if we're not doing it as we should be. Thank you for your presentation.
Thank you.
Thank you very much. Any other questions? If not, I want to thank you for coming in this evening for your presentation. Thank you. Our next speaker is Jennifer Wallner. She's representing herself as a resident.
Just let me share. Bonsoir tout le monde. Je suis très contente d'être ici ce soir. Thank you for the opportunity to address the committee. And I'm speaking to you today specifically about the Healthy Babies, Healthy Children program launched by the province of Ontario and run by Ottawa Board of Health. And I come before you today both as a citizen who has accessed this program and as an expert in social policy. I'm a full-time professor of public policy at the University of Ottawa. Council is considering scaling back access to the program to only at-risk residents, and I'm speaking out against this proposal. We know that the early years from birth to age 6 are critical in a child's development. Healthy Babies, Healthy Children helps support the prenatal and postnatal care for all residents through a variety of services, from free online and in-person prenatal classes, calls from the public health nurse after a baby is born, and drop-in centers that are open on a rotating basis every day of the week across the city. Individual benefits for such programs are clear. For instance, while nothing really prepares you, obviously, for bringing a baby home, prenatal classes help give parents some of the fundamentals: how to change diapers, how to bathe an infant, and teaching them the very important lesson that putting your baby down is better than keeping your baby in your arms if crying is getting too much for you. Asking basic questions, a simple phone call from public health nurses connects parents to the outside world at a time of great vulnerability and uncertainty. They let families know that they're not alone and that there is somebody that they can call if need be. And lastly, drop-in centers like the one run at Somerset West Health Centre, with which I'm extremely familiar, are facilitated by public health nurses, nutritionists, and lactation consultants. Moms having problems with breastfeeding can learn new tricks to make it easier for them. Parents worried about the development of their babies can have questions answered. And nurses are given face-to-face opportunities to explain the benefits of vaccines, for example, all the more important given the recent measles outbreak. Weigh-ins for babies are recorded, providing either early warning signs if something is wrong, or also calming the nerves of nervous parents, keeping them out of doctors' offices. Contact with other babies also furthers cognitive and emotional development as early as 3 months. Such benefits for babies should be enough to convince any government to keep these programs running. Benefits, however, are not restricted to the individual babies. Collective benefits for families are also, and the community writ large, are also invaluable. Let's consider 2. Postpartum depression is a major illness that can affect moms, dads, and parents who adopt. Caring for an infant is often extremely isolating, and having a safe place to visit regularly can help parents see if they are experiencing the symptoms of postpartum depression and seek the help that they need. Ottawa is also filled with families that have just moved and who don't have access to extended networks of aunts, uncles, and grandparents that they can rely on. From clothing exchanges to informal parental babysitting networks, drop-in centers provide a hub for new residents, helping them integrate into this city. In your report submitted to the city, Dr. Levy, you draw attention to the fact, rightly so, that Ottawa Public Health faces, quote, significant long-term funding shortfalls caused both by inflation and insufficient financial support from the Government of Ontario. A gap has thus appeared, and to fill this gap, you are considering restricting access to these programs to only at-risk families with identified risk factors. In other words, a program that was once open and available for all families in the city will now be limited to only those who meet predetermined criteria. If the city does this, a universal program will be transformed into what policy wonks call a means-tested services. And this is a poor strategy for two reasons. First, restricting access to at-risk clients, in fact, often only increase the administrative costs of the program, because then suddenly people who would just be typically servicing everybody who walks through the door now needs to determine if a person actually meets predetermined criteria. Second, universal programs build solidarity and foster shared understandings in communities. Such programs also have greater numbers of people concerned, like myself, who are ready and willing to fight for them should they be threatened with cuts or cancellation. When services are means tested, however, such advocates disappear, and over time, the benefits are at risk of withering or vanishing altogether. This is even more important in the context of a city like Ottawa, where we have many newcomers each year. I therefore ask Council to find the necessary funds to make sure that Healthy Babies, Healthy Children is a program that continues to be accessible to all citizens who live in the city. This is in fact in keeping with Mayor Jim Watson's call to make Ottawa a sustainable and caring city for all residents. Thank you for your time and your attention.
Thank you very much, Ms. Wallner, for your presentation. Any questions or comments from the committee members? No? Thank you. Our next speaker is Dr. Elizabeth Whitmore, representing the Gotta Go campaign.
Some of you have heard this before, and we've met with a number of you, so bear with me. I won't do Shakespeare this time.
We're expecting a song.
I don't have the right costume on this time. The Gotta Go campaign is advocating for a system of open, accessible, free, and secure public toilets throughout the city. This affects virtually 100% of the population throughout the world, and certainly in Ottawa. Next. A lot of toilets could be available to the public in Ottawa, but are rarely open, hard to find, and inadequately maintained. They're open seasonally and often only during program hours. As recreational programming has been cut, the availability of public toilets has also been cut. So where do people go? They go to McDonald's, they go to coffee shops, but often they have to purchase something in order to do that. This is a map of the LRT line proposed, and as you may be aware, there are public toilets proposed for, required actually by the province for only the two terminus stations. 10,000 people are projected to go through this system in every hour. In some stations, people are expected to exit and go to use a public toilet that may be available in the Rideau Centre, for example, but in two of the major nodes, Herdman and Bayview, there are no public toilets. It doesn't, in the design, it doesn't take a lot of imagination to figure out what's going to happen public health-wise with 10,000 people and no public toilets. Our city does not provide this essential service. It involves lost business opportunities. It has obvious health and sanitation issues. Recreational opportunities are restricted if you have playing fields with lots of soccer teams, for example, and no public toilets in the area, this can be an issue. Health and social costs right now are borne in quiet by individuals, many of whom just don't go out. Other places in the world have figured out how to do this. Japan and South Korea lead the world. Many European cities, Oslo, London, Paris, public toilets are taken for granted. Australia and New Zealand have great public toilets and maps to find them. New York and Washington include public toilets in their subway systems. So if they can do it, surely we can too. Make them easy to find. Here's some examples of signage that is used in different parts of the world. The one on the upper right-hand corner is in Glasgow, Scotland. Next. This is a map of the London, England tube, or underground, or sorry, not underground, it's London. And if you want to find a public toilet, you click onto the app, you find where it is, what it offers, when it's open, and so forth. Public toilets can be open, easy to find, accessible, and safe. This is an example of one in Paris. Designs can be attractive, safe, and economic. On the left, you have a New Zealand example. On the right, you have Vancouver, and they have advertising on the outside, which is one way to generate revenue. This is an example from Edmonton, dealing with one thing that it does is deal with the issue of safety, which is a big issue. Many people raise this issue. So this is glassed from the outside so you can see. Obviously you can't see people in the stalls, but you can see the feet. So if there's 6 feet in one stall, you know you might have a problem. They can be very attractive. This is one in New Zealand that was a result of a design competition. They can be designed to resist vandalism and easing cleaning. So this is stainless steel. The toilet isn't on the floor so that it can be easily swept. Many adults need special changing stations. So you need to have changing places where adults with an attendant can be with them. There are 40 of these in Scotland and not one in Ottawa. So we request 2 things from the Board of Health. One is to undertake an analysis of the benefits, program planning, and regulatory framework necessary to establish such a network in Ottawa, with particular regard to the needs of special populations. And secondly, help us to ensure that the resources are made available in the 2015 to 2018 city budget to meet the new requirements regarding public toilet provision in the 2015 revisions to the older adult plan. Open to questions. Thank you very much.
Thank you very much, Dr. Whitmore, for your presentation. Any questions from the committee? Dr. Kapoor?
Thank you for the presentation. Please help my knowledge. I understand that many of those examples that you've given us do also incorporate not just ads, but significant private sector sponsorship, whether with or without ads. And I'm just wondering if you have some details on the extent of that sponsorship and whether, and I understand some of them are just put in place privately without public funding. I'm just wondering if you can help me expand my knowledge on that part.
It would be wonderful to have a study worldwide of that kind of thing. I don't know myself of one, but there are places that make agreements with places like McDonald's or coffee shops, so that, for example, the city could offer a subsidy or a tax break to a McDonald's to have signage and open to the public, which it is virtually anyway, except it doesn't have the sign. So that's a way of cutting back costs and engaging the private sector. That's one way.
Anybody else? No, seeing none. Thank you very much, Dr. Whitmore, for your presentation. So, board members, I'd like to bring the budget back to the board committee. First of all, when Mr. Stewart was speaking, he had a couple of questions that he wanted to pose to the board, and I did not provide the opportunity for the board members to ask those questions. Here's your opportunity to address those questions to Dr. Levy or any of the other public health members that are here, if you do need to address any of those questions. So if you have a question based on Mr. Stewart's presentation, I encourage you to put that forward now. And questions in common also, yes. Councillor Fleury.
Thank you, Mr. Chair. Wanted to start off by thanking the staff at Ottawa Public Health who made themselves available. I had some budget questions regarding our funding sources, and was really appreciative of the time of Lou and Esther gave to me regarding where we receive our funds and how complex it can be for them to put together the budget and how projections happened. So I wanted to mention that, and really in conversations I've had with Dr. Levy regarding the budget, it's a budget where we're seeing more and more pressures. We know the programs that are funded and supported by the city are solidified. We know that there's 1 year funding available through a province, through the ministry, that's clear. The expansion of those programs, or our ability to continue to support our residents remains unsure, and the pressures on the organization will be felt if we continue this pace year after year. So it's important for our board to be aware of that, to have a clear strategic plan in the next couple of weeks to months to identify where we need to put our resources and where we see the importance of focus. But that said, I think that it's a balanced approach, and I know we had public speakers regarding a lot of the access to the food, and I think that's where we can clearly partner with organizations, existing food bank and others in the community, but also with the city. I think there's land, there's assets that we have at the city that can make sure that our community is most vulnerable, and that we inform, educate, and enable our communities to take on the challenge of being sustainable with our food network. And I relate specifically to my area, but I think that the work of the mobile food, I'm sorry, the name is escaping me here, but the Market Mobile and the Good Food Markets and others have been an amazing success. Community gardens, obviously, and we just need to build on that. And I think that through our exercise as a board, we can perhaps focus into those key partnerships that need to be continued and supported for our community. So I wanted to applaud the work of our staff in putting together this budget. And regarding some of the pressures, I know that there's a lot of flexibility, and also making sure that we're able to provide the services that our residents expect, and being there on the preventative approaches, but also on the reactive one when we need to. Thank you.
Thank you very much, Member Councillor. Councillor Chernyshenko.
Thank you very much. I wanted to express a concern that was mentioned by at least one of our delegates tonight, possibly several, and that's around the replacement of in-person services with by telephone and online services. I'd certainly be interested in knowing what really are the economics. In terms of staff time, obviously travel time is going to be saved, but otherwise, still there's a requirement for the person at the electronic end of the line in that conversation to be there. I'd be interested in whether we have or can commit to having a really solid understanding of the amount of savings, and just as importantly, maybe even more importantly at the other end, whether the quality of service by the recipient is still felt to be the same or adequate, because in our rush to, and I think probably every one of us is guilty of it, my communications with my constituents is primarily electronic now. There's an assumption that it will be just as good, it'll get to more people, it saves a lot of money, therefore I can do more with it. But certainly in these people services, I'm worried that we may not fully understand the implications. So I flag that as an issue for Ottawa Public Health to keep close track of, but I would ask as a question now, have we done any surveys on those sort of two sides of electronic replacing live in-person FaceTime?
Yes, not specifically through you, Mr. Chair, not specifically projecting in terms of where some of the future changes are going to be, but certainly to inform and enable our staff to consider what we might take a stab at it on a go-forward basis. So let me preface my comments by saying that I just want to make it clear that when we prepared our budget, we didn't come at it from the point of view of what shall we slash and where can we get the biggest bang for the buck. We came at it from the point of view of what can we reasonably anticipate our funding sources are going to provide for this year and into the future. And to pick up a comment made earlier, a reference to the written report before you, the concept of the multi-year phased-in approach seeks to address some of the concerns that have been expressed. In short, we anticipate a budget deficit when we project not our needs relating to community growth or relating to complexity of service delivery or to new things that the professionals on staff believe might be possible and might be advantageous to the health of the community, but just simply maintaining current activities. And we project what those expenses are going to be, and then we project what we expect we can, frankly, optimistically hope for from some of our funding sources. The city provides very explicit budgetary guidelines in advance of the budget timetable. The province often confirms some of our best guesses, or in the worst case scenario, actually doesn't confirm some of our best guesses several months after we present the budget to you. So in fact, we could be dealing with different numbers into the future, and they're unlikely to be better if you look at the context and the environment. So within that context, we plan our budget, and the fundamental principle, I said this back in January, but I want to take this opportunity through you, Mr. Chair, to reiterate that the fundamental principle that had us look most closely at the family health standard and the services that we provide within the standard was that was the area that when you consider the various funding streams, that was the area that arguably is relatively overfunded compared to some of the other areas that we're responsible to conduct business, for example, vaccination programs. So when we're faced with a budget that is constrained, as we anticipate a go-forward basis, it becomes my responsibility to bring to you our staff's best possible recommendations for how we will best maintain services and how we will best continue to contribute to the optimal health of the community. Those are the principles by which we came at it. We did not assess what specific FTE is going to go and what specific duties that individual was performing, because the very intent that we're presenting is an intent to closely monitor impacts and to adjust our work as we go forward, with the key principle in mind being that we will strive to ensure that health risk is not created by our activities, and understanding the possible consequence on that may indeed be satisfaction may go down. If individuals who are used to what some might call Cadillac services get less than they once might have, or get services in a different form, it's possible we'll see a bit of a dent in our satisfaction scores. But I would say that we monitor closely health in the community, we monitor closely health impacts, and we do indeed monitor the client satisfaction scores of our programs. And Ms. Mogadam will be able to complement my comments probably with specific numbers, but I can tell you that there really are numbers we're very proud of. They exceed 95% pretty much across the board. And we'd love to retain that, and we're going to strive to retain that. We think that we can do it arguably even better, given the way society is changing, using modern technology, but we're going to monitor that closely and be responsive and work in real time. So I think I touched on your questions there. Thank you for the platform, Mr. Chair. I'm not sure if Ms. Mogadam would like to comment specifically further than that.
No, I think you touched on them mostly. I'm just, I guess, as a follow-up or a particular red flag, we need always be aware that there are still, I'm guessing rather than having science, 10 to 20% of the population that either does not own technology, is incapable of using it, cannot afford to own it, prefers not to, and that we don't lose through the cracks, what is bound to be a fairly significant and perhaps the most vulnerable part of our population, through an assumption that we can get to them through other means, social networks, etc., and that we always keep that front of mind when we're looking at changing the way we deliver a service.
Thank you for the opportunity to follow up. Thank you for that point. We're intensely aware of that point. We find in practice, actually, that when we worry about what one might call the digital divide and leaving the social media illiterate, if one can put it that way, behind, as we all grab onto new technologies, we find that in practice that's less of a problem than we anticipate. But certainly our outreach work and our core high-risk work in partnership with the hospitals is specifically meant to identify that group, and we pay careful attention to that very point. So thank you for that.
Thank you very much, Doctor. And if we can hang on to any other questions for 2 minutes, because we're running close to our finishing time of 7 p.m., so Councillor Fleury has a motion.
Thank you, Mr. Chair. Yes, I propose that the Board of Health approves that the meeting time be extended past 7 p.m., not longer than, pursuant to Section 8 of the procedural bylaw.
Thank you very much. Is that carried? Thank you. Okay, back to Q&As. Anybody else on this item? Ms. Poirier?
Mr. Chair, I just had a quick technical question. Obviously the City of Ottawa budget is on the calendar year and the provincial budget is on the fiscal year, so what assumptions do you make in the budget until you have your funding confirmed by the province?
Ms. Mogadam, if you could take that.
Through you, Mr. Chair. Thank you for the question. The assumption will vary from year to year. Typically what we do is we look historically. So for 2014, we received a 2% increase on the cost-shared portion of the mandatory programs and a 0% for the majority of our 100% level-funded programs. So therefore, for 2015, the assumption that we're making going forward is similar. So 2% for cost-shared we factor in, which is somewhat of a risk, and of course we will not know what the funding level will be from the province until much later in the year. And then as far as the 100% programs, we'll continue to assume that we'll receive a 0% increase.
Thank you. Councillor McKinney.
Thank you. Just want to pick up actually from where my colleagues left off, and again, I just want to make sure that I'm clear that I understand staff had some difficult decisions to make. We as council asked you to come back with a budget that met a 2% target. You've done that. And obviously, grateful for, the Ministry of Health, long-term care, their ongoing funding. But we are, we are eliminating a program. I don't agree with it. I will dissent on it. But we are eliminating a program that could very well put new moms and their newborns at some risk. We will take the call from anyone. We will answer anyone's call. But if they don't know to call, or if they don't know to ask the question, or if they don't know that the program exists, we could lose that opportunity for that connection. So. Also recognizing that, the provincial funding for, our 100% funded programs has also not increased, for many, many years. So I don't agree with it. I don't agree with the cut. I understand the pressures that we're under as a municipality, but we have a responsibility, as does the province. When we first started this whole budget process, I know I was very clear that, I wanted to see what 2% looked like. And if it came back balanced without any serious service reductions, that I would be fine with that. And I'm not seeing that. I find that this is a service reduction that I don't agree with, that can put folks at risk in our community, and so I know that our past chair has written to the province and asked for the need for the look at our funding formula, and we await that. But I have to be on record as saying that the province has got a responsibility here, as does the municipality. So I will not support this cut, this reduction, and I will be dissenting on this part of the budget. Thank you.
Thank you very much, Member McKinney. Any other questions or comments? Dr. Lakin?
Thank you, Mr. Chair. Further to the concerns raised by the councillor about changes to the Healthy Babies, Healthy Children, could board staff provide some reassurance to the board as a way of offsetting the emotional nature of the change in funding? Could the OPH provide any reassurance to the board as to their sense of what, if any, change in risk status might be conferred by changing the nature of the way the program is delivered, and whether, first of all, whether or not there is any likelihood that risk may change for our population, and secondly, how might...
Excuse me, Dr. Lakin, if you could speak into the mic,
sorry.
please. Thank you.
And secondly, how might these potential risks, if any exist, how might they be offset by what the budget is providing for in amelioratory mechanisms?
Sure. Through you, Mr. Chair, I'll ask Dr. Etches to comment on those specific issues, as she spent quite a lot of time with other staff looking at that.
Sure. Through you, Mr. Chair. I think there have been some words used here like eliminate and, that we're only going to reach high risk. And I think a little bit of information could clarify that the Healthy Babies, Healthy Children program is continuing. That program will focus on those with risk, but our family health program, which is for all families, it's not means tested. It will not require anyone to come to a drop-in and prove that they have need. That is continuing to be what we say universal, open to everyone. So I think what we're actually talking about changing here to get at the issue of is there then some health risk, is that about 2,000 families after the birth of a baby have currently no risk factor identified by themselves, their healthcare provider, or the in-hospital or midwifery assessment. That 2,000 families, currently they get a phone call about 2 days after they go home. Only 50% or so of those families actually pick up the phone and end up talking to a live nurse. The others get a message on their voicemail that says, this is the program, we're here for you, please call if you want. So it's a small intervention that we're talking about changing. And what we're looking at doing to reduce the risk that those families we do call who say, great, I'm glad you called, I need some more support, that can happen with those calls. We're trying to mitigate that by increasing awareness of the program generally. Every parent will still get the mailed package to their home. So every family will still receive something in their residence that talks about our program and invites them to reach out. But we're looking at increasing the peer-to-peer supports, the other early childhood service providers in the community's awareness that they can at any time send a family that identifies a need for more support to us. So we think there's a small risk that people won't reach out. But that's currently a risk if people don't pick up the phone. So we do need to continue with these other ways of augmenting awareness of our program and increasing people's familiarity with how we can support them. And we will be evaluating this. This is something that we'll be looking at closely and monitoring, possibly entering into some research studies about.
Thank you for that information. That's useful. It helps provide some reassurance. I have just a comment, if I could make, about the councillor's who's left, so I won't make the comment, but it was about his concern about providing this certain services electronically versus in person. And I would encourage public health to take advantage of the beginning literature that exists on examining that very important question as to whether or not there's an actual difference in providing a service directly versus electronically. And there's some emerging evidence that in some cases it may not make a difference in reducing effectiveness. But I have no other comments or questions. Thank you, Mr. Chair.
Thank you very much, Member Lakin. Member Kapoor.
Thank you, Chair. Dr. Lakin's question covered off, and Dr. Etch's answer covered off a lot of my initial comments, which was in terms of assessing the impact of these changes by assessing the risks of the clients who've already been in the program and touched by the program and approached by the program in the previous years. It's getting late, so I'm not going to hold off on my discussion on the root cause of this, other just than to touch on the fact that we have had a freeze in the provincial 100% funded programs, and that I think is something that this board will need to address further in response to Minister Hoskin's letter to former Chair Holmes. But I think we need to remember that, and I'll park it for now for a future meeting. The only additional question I had in terms of how we're assessing risk and trying to make sure that the approach is there, that all are aware of the program. I didn't hear it specifically in Dr. Etch's answer, but I'm assuming and just asking for confirmation that we're going to be enhancing some of the work that's done in hospital pre-discharge to make sure that our partners are making mothers and families aware that services are available to them. And I'm also wondering whether our definition of identified risk factors is going to encompass or include some of those factors that have already identified as correlating with poor access to e-services or poor internet access, such as poverty, rurality, and whether those are going to be incorporated in some of the identified risk factors for the program.
Through you, Mr. Chair, yes, I think that in short I can answer in the affirmative. I will say that the province has sought to improve the risk identification with new risk tools that are implemented right in the hospital. We work in close partnership with the hospital sector, and we also want to be sure that we're also in partnership with those handful of moms and babies that don't deliver in hospital settings. So, from a community-wide perspective, we go beyond the hospital, but for sure those pieces are covered off.
Thank you very much. Any other questions? Seeing none. Councillor Fleury, you have a motion for the amendment to the budget, item 4?
I do. So this is a motion to amend item 4, which is the draft Board of Health 2015 operating budget. Reads, whereas on November 28, 2014, former chair of the Ottawa Board of Health, Councillor Diane Holmes, wrote a letter to the Minister of Health and Long-Term Care, Dr. Eric Hoskins, regarding the Ottawa Public Health request for additional information on provincial funding formula, and whereas the correspondence to the Minister of Health and Long-Term Care is included as document 2 in the draft Board of Health 2015 operating budget report, and whereas the Minister of Health and Long-Term Care, Dr. Eric Hoskins, responded to the former chair of the Ottawa Board of Health by way of letter dated February 2nd, 2015, that is communication item number 4 on the agenda. Therefore be it resolved that the correspondence from the Minister of Health and Long-Term Care, Dr. Hoskins, to the former chair of the Ottawa Board of Health, Councillor Diane Holmes, be added to the draft Board of Health 2015 operating budget report.
Is that carried? Thank you. So based on that, we're in the process of going towards the approval of the budget. Just 2 items that I have to read out before we approve the budget. First of all, I want to acknowledge the dissent on the draft budget by Member McKinney, dissented on the reduction in the budget outlined under 2015 pressure, categories, explanation, more specifically on a multi-year phased-in realignment of health services with provincial funding level, reviewed services to ensure that appropriate resources are in place to meet the health needs of low-risk families and general population on page 17 of document 3. Second item is a declaration of interest for the draft Board of Health operating budget. The chair, the recommendation before the board are approved while taking into account that Member Lakin declared a conflict of interest on a portion of the budget, specifically the $300,000 100% city funding that supports Ottawa Public Health's mental health and youth programming represented as mental health under the city-funded program on page 15 of document 3. This portion of budget was not specifically discussed or debated by the board.
Chair, may I suggest us voting separately on that item so that Dr. Lakin can vote on the budget itself?
Is that okay with on the board? All right, thank you. So if we just vote on this item, is that carried, the Dr. Lakin item?
So just for procedural, Dr. Lakin, you need to retract yourself from the vote.
Away from the chair.
You have to sit. You have to get up from your chair physically. Yeah.
So seeing Dr. Lakin leave the table, is that item approved?
Approved.
Carried. Thank you. Now, come on back, Dr. Lakin, to your chair. So, can we approve the budget as listed on each of the items? Do we want to read them out individually, or do we carry them as entirety? Carry it entirely? Okay. Carried? Thank you very much. Now, I know the time is running late, but this is the first board meeting, and I promise you, or try to promise you, that I won't run meetings any later than 7 p.m. Item number 5, amendments to the Ottawa Board of Health Policies bylaw. The recommendation is that the Board of Health for the City of Ottawa Health Unit approve the amendments of the procedure bylaw of the Board of Health for the City of Ottawa Health Unit as detailed in Document 2. Approve the amendments to the delegation of authority bylaw of the Board of Health for the City of Ottawa Health Unit as detailed in Document 3. Adopt the performance appraisal of the Medical Officer of Health Policy as detailed in Document 4, and direct staff to bring forward a report in Q3 of 2015 with recommendations for a code of conduct for the Board of Health members. Is that item carried? Thank you. Item number 6. Operating budget year and end results. The recommendation is that the Board of Health for the City of Ottawa Health Unit receive this report for information. Is that received? Thank you. Delegation of authority contracts awarded for the period of October 1 to December 31st. The recommendation is that the Board of Health for the City of Ottawa Health Unit receive this report for information. Is that received? Thank you. Motion to adopt reports, Councillor Fleury.
Thank you, Mr. Chair. Be it resolved that the election of Chair and Vice Chair report, the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, the draft Board of Health 2015 operating budget report, amendments to the Ottawa Board of Health policies and bylaws, 2014 operating budget year-end results, Board of Health for the City of Ottawa Health Unit status report, and delegation of authority contracts awarded for the period of October 1st, 2014 to December 31st, 2014 be received and adopted.
Is that carried? Thank you. Now, there are no notices of motion that was given previously. Motions requiring suspension of rules of procedure, we did not receive any at the present time. Notice of motion for consideration as subsequent meeting. Any notice of motion for that? No, seeing none. Information previously distributed as listed on the agenda. Can we receive that? Thank you. Confirmation bylaw, Councillor Fleury.
Merci, Monsieur le Président. Confirmant que le règlement 2005-2 des règlements du Conseil de santé de la Ville d'Ottawa confirme les procédures du CA de Santé Ottawa de la rencontre du 2 mars 2015, qu'elle soit lue et passée.
Carried. Any inquiries? Seeing none. Any other business? If not, can I ask someone to move the adjournment? Madame Poirier, thank you. Our next meeting schedule is for April the 20th at 5 p.m. in the same place. So thank you very much, everybody. Thanks for the participation.